Hi everyone, my name is Dr. Igor, I am clinical oncologist practicing since 2010. And today is the next video about immunotherapy, cancer immunotherapy, and we'll talk about these guys, natural killers, which can destroy tumor cells if they're functioning properly. Their first defense against tumors, and T cells, they check if their cell has a normal genetics, because every cell has a major complex of histocompatibility. It's like a flag on the surface of the cell that shows, oh, this is my genetic code. And T cell comes, watches this genetic material, reads it, and if it's normal, it's okay. If it's not, it kills the cell. But some cancer cells, they will not show this foreign genetic material. Then natural killer will come, see, oh, this cell has no flag, that's why I will kill it. So no chance for cancer cell. Unfortunately, cancer cells can produce some cytokines, for example, TGF-beta or interleukin-10, that will inactivate natural killer cells. So the first attempts of this immunotherapy were to activate them, to inject interleukin-2 to produce something like, these interleukins are cytokines. You know COVID, you know cytokine storm, when the immune system becomes really crazy, attacking everything. That's what's going on here. It's more old version of immunotherapy, targeting the non-specific immunity, and it's more dangerous. And I can't say it's very effective. Afterwards, they found out that interleukin-15 is more safe and can do the same function. And here you can see how many trials are going on now. Unfortunately, these are phase 1, phase 2 trials, still figuring out dosing, safety, etc. And these are adaptive immunotherapy, meaning they will take their natural killer from patient's blood, from donor's blood, from cell lines, from umbilical cord, different sources. And they will multiply them, they can genetically modify them and put back to the patient. And this is autologous, meaning that these natural killer cells are from the patient. There are other studies. These are allogenic, meaning that they are from the donor. And you see mostly they used in hematologic malignancies like leukemia, like multiple myeloma, but also in some solid tumors too. And more continued table. Also here you can see they use the cell lines because the patient's natural killer cells are put back to the patient, for example. There may be a problem because the cancer cells may have some genetic similarities with normal cells of the patient, and natural killers may fail to detect this tumor. But if they use donor's natural killers or if they use cellular lines, this problem is not present anymore. So we will see what results they will get. Also, they can genetically modify the cells or use some adjunctive substances to enhance their function of natural killers, to make them stronger, better infiltrate the tumor, better survive, etc. So you can see that really many trials are going on, and we must wait for the results. I'm sure that in the near future we'll get something really significant. For patients who are getting chemotherapy, and if the doctor said, oh, sorry, but this is chemotherapy for you, you can't be healed, but chemotherapy will prolong your life, increase the quality of your life, it's necessary to search for some alternatives, to search for maybe participate in clinical studies, to search for something, for some alternative options. Because in some cases, we don't know why, but sometimes immunotherapy can totally remove all the cancer from the body. We don't know in which case it will happen. And this is all for today. In the next video, I will tell you about the vitamin C therapy for cancer patients, how it will improve their results or it won't improve the results. So we will talk about this topic. It's very interesting. I wish you good luck. God bless you. Bye bye.